Okay, this is a really interesting case because it's very difficult to actually stage this one. I may not get through everything. We might do a couple versions of this. So let's see how far we go. This case, his patient has not really seen a dentist in about 10 years and has kind of let things move along its own path. And has had limited resources to actually address this issue, but she's very concerned about, well, what am I going to do with my teeth? She's in her 40s, I believe, or even late 30s, I believe. So this is very disheartening for her when she really can't chew and she's feeling like her teeth are moving a little. And I think the spaces across their front teeth here kind of are expressing that movement. They're kind of drifting out. People sometimes say they feel that her teeth are floating or that they just don't feel confident biting. And a lot of that comes from there's no compressive load on her teeth here from having no back teeth. Back teeth I call the hammers. They're the munching teeth up and down, whereas the front teeth are the slicing teeth, where you're going to be cutting your food so you can get them to what the munching teeth would do, or the hammers and the scissors. And here she's very concerned about the big hole here, but also just how her teeth come together. So the first thing is, how do you stage this through? Well, the first thing is obviously you got to get out anything that is causing her pain or has a big infection going on, and try to solve things in a way that if there's something hopeless or useless, which would be these teeth, I don't have to really address them if they're not giving her pain or discomfort. I could just say, okay, well, these teeth right here, let's just accept that these are all coming out over here. And whether they're in here for another month or 3 months, it probably won't matter. I don't see a lot of bone infection. That's not my primary concern, even though it looks very dire over here. That's not the big problem. The problem comes more over here, so we'll focus on that. So that helps patients understand, like, okay, we have a system, or that there is some sort of prioritization that they can lock their heads around when they don't know at all where to start. This patient had no idea whether she should be working on the upper teeth or the lower teeth and those things. And this gives her a little clarity. So I said, okay, well, half of her mouth right here on this side, from here over, don't worry about it yet. We'll talk about how to get teeth into our primary chewing area up here later, and how to get teeth here into the last part of the last chewing area here on the lower. So now she would have full function and have that compressive chewing mode back in, so she could still try to cut her teeth with the front teeth and chew on her back teeth there. So focusing over here, she might have a couple cavities here, which is a lot better than root canals and crowns. This is a root canal and crown treatable tooth, so I did recommend that. She has periodontal disease for sure going across all of these teeth. She did get a cleaning somewhere, even though I said she hadn't been to a dentist in 10 years. She's trying to come back, so she had gone to a dentist, and then she got confused about what that dentist was actually telling her after the cleaning to get all of her teeth out. So that seemed kind of strange, but I agree. So I told her you have many options because she has a lot of bone around in different areas. And I shouldn't say a lot because she has a pretty severe constriction, but it's not a total hopeless case if you did remove the teeth. But if she did remove her teeth, she's going to come up with different problems because of the bone constrictive nature of her anatomy, which we see right here. Here's a very severe constriction here, less so on the upper. But let's address still our staging issue of where to address things first. this is going to be the first thing you'd want to do if she elects to save her teeth. That's something that has to be set up front here, is does she on the lower arch want to maintain her teeth? And I would say yes, because on her lower teeth, a root canal and a crown here would solve this problem. And then that means from here to here, she has everything available, and she can chew on premolar. So she has premolar occlusion, and then she does have bone in these areas for implants. So she could do 2 implants, single tooth implants. In that position is a good position for a full denture later anyway. You want the implants in a molar position, so then why force yourself to take everything out just to put 2 more implants and then get a denture? It's going to cost her $10,000 or more to do that, whereas if she did 2 single tooth restorations and a root canal and a crown, she's going to be in the $7,000 range, so she'll save a few $1,000s and keep natural teeth. Now the problem is the periodontal disease here. If she keeps that clean, she can keep those teeth going along the way, and then we can do little bridge work or something else if she does lose some of the front teeth. But she has some bone around these canines, at least 50%, at least on this one, maybe a little less or close to that 50% mark here as well, that you could use those for bridge work. So this really comes down to a home care situation, or what's causing the periodontal disease first. So if she's not ready to maintain her natural teeth, then all of that bone height is going to take effect, even worse, and cause worse problems for her natural teeth. So she has to be realistic about whether or not she's able to maintain her natural teeth before she keeps it. So I don't know what her final say is on the lower arch, whether or not she wants to elect to do that. My recommendation would be to keep her teeth, because when she has this type of constriction going on, let's go down to, let's say here, when you take these teeth out and you put a denture onto this, all that bone is going to resorb back in a way. The denture is going to be flopping on it, and it's going to be very challenging to not only deal with that constriction and how the bone is going to resorb, but we're going to have a prosthetic problem because she has very flared teeth, where her teeth do not come, they come very angled to how her lower front teeth come together. Once again, this flare, especially if she has an upper denture, is going to be very difficult to maintain stability, even if you have locators or something else. You're gonna get a leverage point here. So if we were to do a denture on the upper and a denture on the bottom, we want to bring her teeth a little bit in, and that's going to change the look of her face a little bit. And also it's definitely going to change the look if she's used to the gaps in her teeth. I get the sense that she doesn't like the gaps in her teeth, because she wanted to talk about orthodontics as well. And I'm not a big fan when you have that kind of periodontal disease, but that would be something that an orthodontist can skill her on or advise her on. But the way her teeth come together, it's going to be difficult to do. You're going to have to do the upper arch and the bottom arch to do orthodontics in this case, which is going to be more problematic for her financially to deal with. So looking at now what is the next step here, she has to kind of figure out what she wants to do pro keeping her teeth. Now this tooth is kind of a loss on the upper here as well, and the tooth next door has a lot of bone loss going around the distal wall. So my suggestion for her up here was actually to extract those teeth so she can maintain some sort of bone there. And if she did, she would have room for an implant here. This implant site would require a sinus lift. So this is a red on our sinus chart of assessment. And that would be how she could get teeth back here as an implant and an implant here. It's going to take multiple grafts to get that done. So she would definitely got to get these teeth out down here. That's a given. So staging it once again, I would recommend treating her on this half of her mouth first. If she elects to try to keep her lower teeth, then I would start her at this root canal crown, and any fillings on this side I would do first, even before extractions. These are hopeless, so I'm not, and she's not in pain over these. She's not in pain over anything here. So the day one would be root canal and crown and any fillings if she elects to keep her teeth. Now, the second appointment, after doing the root canal, or the third appointment, whatever it takes to get the root canal and crown here done, and the fillings, then I would say do the extractions here. If she elects to do a full arch replacement with 4 implants, I would tell her to pick one arch, and that would be the lower arch first. And then I would say elect the upper arch. And when you do the lower arch, we have to have anticipation. I would give her an interim denture, putting her teeth in the very same position that she has them now, knowing that if we do an upper arch and lower arch 4 implant case, so we remove all the teeth over the next 2 years or whatever time period she wants to, we know that now we have to try to move her teeth more into a proper position to keep the balance of those 2 dentures together. So this is an interesting case, and I have not yet heard back from her. We just saw her yesterday. So I'll give her time to kind of absorb what I've said, and to give her time to have more questions. And she can elect both options here. And financially, it's going to be more expensive to take all her teeth out and do the 4 implants. But she has a staging way to stage it where she can start putting money towards implants that would work towards a 4 implant case, and then still maintain some of the normal natural anatomy and tooth function that she already currently has, and not go through a big life-changing event as it is when you do remove all your teeth and get 2 dentures. So very interesting case. We will be following up with this one probably in the future for sure, and we'll see where this patient goes and what she decides on doing. Great, thanks.